So today we have a very, very special guest, and this is someone that has been a massive part of my life. And his magical hands have been a reason for where I am today. It's Dr. Bryan Mayou. Could you please introduce yourself?
Well, I'm basically a plastic surgeon, and as a plastic surgeon, one develops certain interests. And I worked at St Thomas's, and before that, I worked at Great Ormond Street. And one of my interests certainly was these giant congenital melanocytic nevi. I had other interests like um, epidermolysis bullosa. I mean, all these were other rare things. They're all very rare, and therefore they were always neglected. And I'm very pleased that I was able to there really at that beginning when we suddenly started looking at the problems and looking for solutions. At the same time at St Thomas's, I was doing all the other reconstructive plastic surgery. In particular, I was there at the beginning of microvascular surgery, where one was moving tissue around the body, joining up little 1 millimeter blood vessels to keep them alive. And that was, so I was there at a very exciting time where there was lots of new things. Tissue expansion was another, which was new. I mean, there were people just beginning to do it. And so when I was doing it, a lot of the areas where we do it hadn't ever been recorded before. So it was new, trying to find solutions. I was very fortunate that I was there at a very exciting time. Plastic surgery has changed a lot these days. So when I was at St Thomas's, when I was a junior, there was one plastic consultant. I was the second. Now at St Thomas's, there are 26. I wonder what they're all doing, really. But anyway, there are 26. And Great Ormond Street, there were 2 consultants. And I don't know how many there are now, but there must be a dozen, I should think. There are lots more, and that means everyone's very specialized these days, whereas we had to do everything. And so these specialist interests were we had to carve out of time. And then at the same time, I had a private practice, which and I've started a day surgery hospital in central London, which is actually over lockdown has actually benefited. I mean, it's extraordinary. Yeah. Could explain it, but it's not probably terribly relevant. But it has benefited, and I'm very lucky that I've got 2 sons who are running it, because they run it better than I would, and they're running it as from administrative, from a business point of view, rather than a doctor running it. And of course, doctors aren't always the best businessmen. So that means that that's working well. So there we are. I'm actually, as you can see, I'm not in London now. I'm down in the country, where I am most of the time, and I have been in lockdown. So I've been extremely lucky again that I've locked down.
But it's the safest place to be in a time like this, and especially how it's affected many people, and it's I think changed how we view everything, and it will for the rest of our lives. And
oh, absolutely.
and I just wanted to know, would you say that you've operated on a lot of people with CMN? Oh, and was it like quite a common occurrence for someone to have CMN?
Well, of course, the big CMNs are really very rare, but we set up a clinic initially at Great Ormond Street with the dermatologist. David Atherton was the main one, and he did a lot of research as well into CMNs. which we contributed, etc., from surgery point of view. And we set up a clinic. And Great Ormond Street has always been any problems, pediatric problems, which are really difficult in the past, have always ended up at Great Ormond Street. I know there are other really good pediatric centres now around the country, but and also they benefit at Great Ormond Street because they get a lot of foreign patients coming too. So things that are rare in the general population can be very common in that environment. And then when I was at Great Ormond, when I was at St Thomas's, we continued doing these clinics, and so they came to us, and actually we got a lot of experience, and we were keen. I think that's the other thing. If you're a doctor and you're told you've got to look after varicose veins, and you're not really very interested in varicose veins, it's a chore. But we were all very interested in CM, partly because it was a challenge, and partly because we could see that nothing really had been done about it. I had the experience of when I was a junior, or I was fairly senior junior, at Great Ormond Street. They were coming there already, the patients, but they were all treated in the same way. And the way that they were treated was that a big CMM would be cut out and the area, a skin graft put on it. Yeah. Now, I used to see these same children coming round again, because what happened was you can't just do, if it's a big one, you can't just cut it all out. It's too big an operation. So you do what you can and put a skin graft on and say, come back in a few months' time, and we'll remove a bit more. Well, then the waiting list probably would put it back a few months, but they'd come back and we do a bit more. But during those months, the child has grown. And so I realized after a bit that if they only came back for an operation once every 6 months or a year, you're actually never going to remove the whole lot, because I mean, they were growing faster than we were removing it. Yeah. And the result from a skin graft, can be quite disappointing anyway. So that's how it was being treated, and I didn't think it was. I thought we had now, there were these new techniques coming in, so we changed it, and also so the two things was to change the techniques and also to try and operate on the children when they were small. Yeah. So when they're babies, they're not very big, and you can do more, and they're quite resilient at that age. And we may think, well, it's dangerous operating on babies, but with experienced anesthesia and so on, you can do masses more. And then with a bit of luck, you've done most of it. And as a child, and a baby doesn't remember anything. Yeah. So they don't know that they've had umpteen operations when they're older. And so they've never known the problems. They may still not be perfect, but at least they've not seen the worst of it, and maybe other people's reaction to the problem is therefore less than it would have been. So that was our way of, that was my way of looking at it. And also David Atherton, the dermatologist, we very much thought alike.
Yeah, and when it's a baby, as you said, they're more likely to not remember what's happened, and it will be easier for them growing up. And yeah, when I was a baby when I was operated on, and I don't remember any of it, which I think's the best thing.
I mean, the other point is, when you're operating on an older child, they don't really understand what's going on, and they think, why are they doing this to me? And they then say, I'm not going to have the surgery. And so it then becomes very difficult for the child, and particularly the parents, because they're dealing now with a rebellious child, and they don't like inflicting painful operations on this child, and of course, and the carers, the surgeons and nurses, it's upsetting for them, because you don't want to be operating on people that are obviously unhappy and don't want it. So getting things done early has been, I think, an important advance. But there are still people, I think, in those days, a lot of the doctors, in fact, most of them, in fact, almost all, except us at Great Ormsby, would say when they saw a problem of CMNs, they would say, well, look, and they didn't have a really good solution either. So they'd say, well, look, we'll let the child grow up and they can decide for themselves whether they want to have surgery.
Mm.
And well, of course, by the time they've grown up, so they may be then probably a teenager by this time, and they say, and they were suffering as a teenager, that they'd want to have surgery, but then it's very much bigger operation. It's much more of a challenge. It interrupts all their schoolwork, and later on, it just goes on and on. And so I think that, although it sounds all right to say let the child decide for themselves, I always felt that it's not for the child, it's for the parent. That's what a parent's job is to look after their child and to make these decisions. Not just to put it off. It makes things worse, not better.
And also,
if you're going to do surgery, of course, you may decide that actually, well, surgery isn't the right thing, and the parents think, well, I think it'd be better. And it depends a bit where the CMN is too.
Yeah, and sometimes it could be precancerous. I think mine did, and it could lead to health conditions later on in life. And I personally think that my parents made the right choice in removing it, but people can do whatever they want if they have CMN as well. And obviously, it's definitely not an easy job, and you need to be very good with your hands. You have to be very focused, and you have to be very intelligent as well. So, what would I like to know is, at what point in your life did you realize that you wanted to become a surgeon?
Well, I think I always wanted to be a surgeon. My father was a doctor, and my mother was a physiotherapist. I got an older brother who's been staying with me just the last few days. Has gone, and he was very bright and got lots of scholarships and so on. And I went away to school. I always wanted to be a doctor, but then when it came to actually deciding on A levels, I suddenly decided I didn't want to be a doctor, so I got the wrong A levels. Then I went back to it because I couldn't really think of anything else, because I came from a middle-class family where there weren't too many choices in your career. It seems odd now because everyone has every choice, but if I wasn't going to be a doctor like my parents, which was the usual thing for doctors' children to do, was to do medicine, I'd have to be either a lawyer or an accountant. And I didn't really fancy either of the other. So I did medicine. I got the wrong A levels. And then I couldn't get into university. I mean, I got poor because I never did any work. I didn't really see the point of it. I did eventually get into Birmingham University, which is my local one. My father had trained there and he knew the dean, and in those days knowing the dean was quite helpful. These days you wouldn't dare mention the fact, but so I did get in, and at that point I suddenly started working hard and was interested, and I always loved it ever since, and I always wanted to do surgery, not medicine. And it's also, I suppose, surgery in those days was a bit more glamorous, and things like sort of infectious diseases and virology, which at the moment absolutely to the fore, you never really noticed. I mean, it wasn't anything one would ever do. You'd have to, you wanted to do something which was in the forefront. And so I always wanted to do surgery. And I thought plastic surgery. I did general surgery, which is what one had to do. I did a lot of general surgery, and then I was working in East Africa, in Tanzania, where I found that it was a very good hospital run by expatriates on Kilimanjaro, on the foothills. And I realized that there were certain specialties out there were incredibly important, and orthopedics was important, of course, because it wasn't just, say, saving lives so much as making the quality of life better, because people with a fractured leg wouldn't perhaps never walk again, so. But plastic surgery was really important, because even a little infection could end up losing lots of skin, and there's lots of deformity and burns and so on. So and there was a plastic surgeon out there who was inspirational. So that's why I went to plastic surgery, and that, one thing led to another, really. But you can't necessarily, once you in those, you direct your life exactly, because it depends where the jobs come up. Which jobs you get, and if it doesn't come up at the right moment, then you never get any experience at Great Ormond Street or whatever. So I was lucky in that respect.
Yeah, and that's just amazing, how everything came together, and how you became to treating thousands of patients, and thousands and thousands. You've treated so many people, and what would you say is the biggest challenge that you've had to face in your life to get to the point where you are today?
Well, I mean, the biggest challenge was actually getting into medical school, quite honestly, because I'd really had very bad A levels, and I had no, so it was really scraped in. So that was the biggest challenge. And after that, I mean, there were challenges. I quite like challenges, and some challenges are nicer than others, but medicine there was a path, and once you entered that path, you just kept going along it. And little challenges along the way, but you didn't. If I'd deviated from the path, it would have been a challenge. If I'd after a bit decided that I wanted to do something else, which people do, I mean, very happily, but that would have been a real challenge. So actually, all I did once I got into that path was just to stay on it, and then make the odd decision whether to do plastic surgery or not, or which jobs to apply for. But they weren't really chosen. And then so then actually I just kept on the path, really. I don't think it was anything more than that.
Yeah, and would you say there was anyone there for you that stood out for you, like a role model? It could be a group of people, it could be your family. Would you say there was some?
I think I did just mention this man, this plastic surgeon in Tanzania. He was the most influential. And I was only there for 6 months, but he is a man who went out to East Africa as a young surgeon because of his asthma, because he thought that he felt it would be better in climate. And he was an absolutely marvelous man, because there was no hospitals really out there then. There were no hospital doctors. And he went out as a specialist, and there was also an ENT surgeon, I think, who went out at the same time. And so everywhere he went, he was seminal. Everywhere he went, he built a hospital, and they all blossomed. So, all the teaching hospitals, and also he founded the Flying Doctor Service, and he used to fly his little plane. So we were on a hospital, I said, foothills of Kilimanjaro, and he used to come in on a Friday, as I walked across the coffee chambers to the hospital to work, I could see his little plane flying in, and then he'd operate all day. And I was operating a lot on my own, but I was operating with him. I spent time with him. He'd doing all sorts of good things. And then he'd go to his farm up on Kilimanjaro, and then he'd come back on a Monday morning and do his outpatients, and then he'd fly off for the week. And then on Friday he'd come back. So where have you been? And he'd say, well, I've been up to see Dr. Banda in Malawi because he wants to start a flying doctor service. I went to get a plane in Cairo. Then I went to some tribal wars and removed treated spear wounds, and then I went somewhere else and I was doing prostatectomy, which was general surgery, of course. I mean, but it was the fact that he was just everywhere he went, he was just influencing, and he's all really, people probably forgotten it now out there, but he got a knighthood in the end. He stayed out there, and I don't know whether the flying doctors were still going, and the hospitals were all still going. I went back to the hospital, oddly enough, just really on holiday just recently, and they said, oh, please stay, please come and do some more work. But and that was very good, because now it's run not by expats but by the Tanzanians, and they're actually doing very well indeed, and some departments better than others. The dermatology department was absolutely phenomenally good because they got a lot of money from drug companies.
Oh wow, that's amazing how he flew a plane and he managed to operate on so many people.
He
Save.
was amazing man, lovely man. Michael Woods, his name, Sir Michael Woods latterly, and then he had a brother who did extremely well in Oxford. He founded the Oxford, what's it called, Oxford Instruments Company, Oxford something company, and was hugely successful. Anyway.
Yeah, well, that's absolutely brilliant. And how he inspired you, and you got to work alongside him. It must have been absolutely brilliant. And I can only imagine it must have been, I think, difficult, especially in Kilimanjaro, and there must have been um, more harder than it is in England as well.
Well, if you do good medicine, you can do it with, you couldn't use disposable instruments and things. Everything had to move. You had to be able to. We took skin grafts with a barber's open cutthroat razor.
Wow.
Because it's something you could just sharpen again and use again. It wasn't quite as efficient, but you couldn't use disposable blades like we would have now. We certainly didn't have the electric ones that everyone uses these days, but it worked well for that in that environment. I think it was a very impressive hospital.
Yeah, that's brilliant. And
in those days, of course, when we were learning, we were really apprentices, and we learned from our bosses who we all revered, and there were lots of other really good surgeons that taught me, and so they taught us, we worked for them, and they looked after us, and they'd find us the next job or whatever it was. Nowadays, I'm afraid hospital medicine isn't quite like that, and nobody knows who they're working for, and there's nobody. It's really I wouldn't want to be doing it now.
yeah, and speaking about now, and people training to become future doctors and their students. Do you think that this is going to be a massive setback? With COVID-19 and coronavirus, do you think that it will be a massive setback on the students and the future doctors? Do you think their education will be,
Well, I'm
really
not
suffer?
sure really, because obviously there are more applicants now for anything in healthcare, medicine, nurses, they've all gone up as a result of this, because people, they like caring, it's something that people like to do, and they can see that they can make a difference. And so the specialty of virology and infectious diseases and so on has become really important. And so I've got a nephew who's a young doctor, and that's what he wants to do, is infectious diseases. Where I wouldn't, in my day, I wouldn't even have, I wouldn't have really known about it really. And I think the doctors who have been involved in it all have been working very hard, and it's, they've done, and of course all of them, the nurses and the porters and everybody. I think they've done an amazing job. How it's affected the young doctors, well, I think in a way it's an experience that is unrepeatable, and they will, or should anyway, benefit because they've had this great challenge, and everyone will remember it in the future. And so my young nephew's been working in intensive care and so on, and getting really exhausted and so on. But I just think I think it's I don't want to say it like this, but it sounds bad, but it's a marvelous experience for doctors. Do you want to be, I mean, you want to be seeing diseases. I mean, that's what you want to be doing. That's what you're doing it for. So I know that, and what I'm saying is may not be what everybody's actually saying elsewhere, but I just think it is a great. When I first qualified, there was a flu epidemic, a big flu epidemic in Birmingham, and I remember going to my first job, and I should have been working for the professor who was who looked after diabetes, basically, and I should have had about 12 patients to look after. And when I went in, so I said to my priest, we changed every 6 months in those days. I said to him, "Well, you know, where is the middle of the flu?" I said, "Where are the patients?" And he said, I said, "How many?" He said, "Well, I don't know really." He said, "There's about 60, I think." And I said, "Where are they?" And he said, "Well, they're all around the hospital, because wherever they could get a bed, they put them in." I said, "Well, who are they, so I could go and see them?" He said, "Well, I don't really know." He said, "I mean, you'll find out because I'll call you." And I remember being called to see patients, and the first time I'd know about them was when I was called up to certify their death. I mean,
Oh, wow.
I mean, so it may not be quite as dramatic. I mean, it was dramatic at the time, because there were all these people dying from flu all over the place, or elderly people mostly, of course. And but I think for me that was, you know, I remember in hindsight now, but it was an extraordinary experience as well as hard work. And now this is, of course, has gone on and on. I mean, the flu epidemic had finished in a month or two, but
Would you say that was quite a traumatic experience, you know, being a student doctor and having to do that? Or do you think that, you know,
well, it's
if you're going to
traumatic, and I think, but I don't think that it's like being an army doctor. You know, if you're out there
yeah,
in Afghanistan or something, you don't go out there. Under protest. I mean, the doctors out there want to go out there because there is all the injuries, and that's what they want to do. And so I don't think I don't think doctors should complain too much if they well, obviously they're going to get tired, but I suppose I'm most sorry for those medical students. Well, no, because they, you know, if they're not being properly, you know, having, like all, no different from any other student, that they're not getting the teaching that they ought to get. But I'm sure they'll all catch up. I feel more sorry for the students. The young doctors are busy, but they're getting experience.
yeah, but I suppose if you want a career within medicine, you have to be resilient in some sort of way.
But I think people are very resilient. I think the health service has shown extraordinary resilience, quite honestly. I mean, it has, and the doctors, everybody in it, and the whole administration, I think it's been phenomenally good. And, you know, people pick out where things have gone wrong, but I think everything has gone really right. Just a few things will always go wrong whatever you're doing.
Yeah, and the world is going through a lot of tough times at the moment, and obviously coronavirus taking the spotlight at the moment. But if there was, you know, an issue that you would say hasn't been given enough recognition, what would you say that issue is?
Well, I mean, I suppose it's not going to be a very exciting comment really, but I mean, it's obviously the future of the world, and the
Yeah,
environment is the thing, and we are now looking at it, which is great. I mean, and maybe some countries, you know, Australians are still opening new coal mines to send to China and so on. And I'm sure they're wrong, and they're doing it still, and China's still using more coal every year. But I think we've sort of got to the point now where it's dawning on everyone really, and even the Chinese rulers. I
yeah,
mean, Trump's gone. I hope he's gone forever. But
yeah,
and Joe Biden seems to be, he seems to be amazing. Really, he's done so many good things. I hope he can carry them through. But I just think the environment is just the overwhelming issue, really. I don't know at another level. Of course, it's always the people who have been left out in society who don't engage, and all the young people. And I'm afraid I don't really. It's something that bothers me, but I'm afraid I've never done much about in my life. But I always feel about it, and I think, well, how can we get people to engage? And drugs, of course,
yeah,
I think we should legalize all drugs just to get
yeah.
rid of the crime that goes with it.
Mm.
But anyway, yes, those are the
Yeah,
issues that bother me. But unfortunately, I can't say that I personally have done much about it, except grumble.
yeah, but it's getting to the point where now it's going to become irreversible. I think it pretty much is now, but this is our Earth. We only get one, and we need to take care of it. Um,
Yeah,
but yeah,
exactly.
that's a good point. So um, what quote would you say that you try and live by every day? You know, it might be one that you've made or heard. It could be anything. What would you
Well, it
say?
could be, but I don't know really. I mean, I haven't got a quote that I live by every day. I know when some people do, but I don't really. I don't have quotes that I live by. I just really um, live from day to day and have my various sort of aims in life. And but I don't. There aren't. I can't just think of a particular quote. I bet, it's obviously not in the forefront of my
Yeah,
mind. Otherwise, I'd come out with it. But I think I shall
that's
disappoint you.
fine. No, it's fine. Don't worry. And do you feel there was enough done regarding equality and representation within the media? Obviously, if people do go through surgery, or if they have a disability, or if they have a facial difference or disfigurement, as I'm not really too keen on that term, but it is still a term. Do you think there was enough representation in media?
Well, I mean, I think the media has been very useful, and there have been such big advantages. And we never,
Mm,
in my childhood, you never thought about putting a ramp for a wheelchair, or
yeah,
I mean, or making any sort of concession for anybody with a disability.
mm,
And now, partly by regulations, but also by people's attitudes changing, I think it's so the media, I think, has been very, very useful in that respect. And without the media, it wouldn't have really have happened. I
yeah,
don't. So in other ways, of course, the media is very destructive, and
yeah,
but not in this particular respect, I don't think. But it's very destructive. I think the constant criticism of and the spotlight on people who can say, we get quoted for on social media or whatever for saying things which are not appropriate. But I often look at what they've said and I think, well, it's all right if you're with your friends or you're not expecting to have it published. I think, and I'm not at all a great fan of Boris Johnson, but he's the sort of person who's always saying things that are
yeah,
stupid. But most of them are just him, the way he thinks. I'm sure. I mean, gets criticised for just saying things, and when you look at them, you know, it's just somebody. If you're having a discussion with somebody, you do say that you may go to an extreme while you're chatting about it. Is what you do in the end, which is important. And so that's, I mean, I'm not going to defend Boris Johnson at all, but you know, but it could be all these quotes, and people get they're so scrutinized. It was much better in the old days where there wasn't the media and politicians. You got good ones and you got bad ones. I mean, I imagine Winston Churchill wouldn't have got very far in this day and age. And he made some bad decisions at times, but overall, of course, he did extremely well.
Yeah, I also think nowadays the media tend to emphasize certain things, you know, and like sort of take a couple words or a phrase out of sentence and you know, misinterpret it. And I think uh,
Yeah,
I think a lot of people nowadays are sort of in a way gullible to
yeah,
the media, and they kind of get a lot of their information and they take it word for word. And I think it's again a
no, I
bit,
think you're right. I agree absolutely. Um, it's just people talk about things they know nothing about, really.
yeah,
Uh,
yeah. And you know, I'd like to thank you again for you know, having this interview with me. I find it very interesting to speak with you. I don't think we've ever had like a chat like this um in a long time, if we've ever had one like this. So just to end off the interview, what would you say are your future plans, or do you think you're just gonna lay back and take a chill pill?
well, of course, this COVID has changed things for me
Yeah,
because I've been confined here and not in the clinic. But and I'm lucky that I've got my two sons there. But I want to I want to get re-involved in it. Well, I am doing things from here, of course,
yeah,
most of the day. But so I'm actually so I'm going to. What my biggest drawback to everything that I do these days is my poor IT skills. And you may think, you know, you do things naturally and so on. And I'm so bad at it, and I don't really remember what I'm told. So um, I'm going to have to get a secretary again, part time, just to be able to make sure the printer works and tell me all the how to do things and help me do things. And then I should be much more effective again. At the moment, I do feel rather ineffective for what you would do with a computer and you do in 10 minutes. It probably takes me half a day to do by the time I've worked it out. I'm on the time to all the time to our IT maintenance people, asking them how to do things. But from could be Zoom or it might be the printer, you know, but that's and everyday stuff. But I don't make. Yeah, so I'm really looking. So that's going to, I hope, getting someone to help me with that here with me. Will be really good. And then I hope that with the clinic, which has changed a lot because of COVID, we will expand that. And you know, we're actually doing a refurbishment at the moment. Means we're closing the clinic for a couple of weeks. It's really expensive. It's been going on anyway, but the clinic has to close for 2 weeks. So it'll, once that's settled down, I think we will look for expanding it and doing other things.
yeah.
I don't know about. I mean, I always feel a bit guilty that I've not done more in Tanzania on Kilimanjaro, because I always imagined that when I retired, that's what I would do, would go out there and work. And of course I haven't, because I've had this private clinic, which is taken up a lot of time, and I've not had the time. So all the good works that I was expecting to do in my retirement, I'm afraid I've not done. I still, when I think about it, I feel quite bad about it. But because
No.
I have got those skills and I could have been doing things. And of course, trouble is, as I've got older, I realise I don't have the, you just don't have the stamina anymore. So I wouldn't be able to operate all day. I mean, I couldn't, one little procedure would do me for the day now. I can
Oh,
advise other people, but there we are.
yeah. Well, you've done so much, and I think, especially it's hard times now in everyone, and we all find different ways to cope. And some people find it very, very difficult, and they have very serious mental health problems. And I think it's just we should be happy with ourselves, even if we're just happy, and no guilt needs to be felt because you've done actually brilliant work. And
Well, I think this mental health thing, which people never, it's really interesting. Everyone's quite happy to say they've got problems now, and I think
yeah.
that's really good. It's
Yeah, it's
fantastic. I think this is
it's
over.
quite sad for people who have mental health, and I think it's definitely got worse over lockdown. But hopefully, as soon as things get back to quote unquote normal, I'm not sure if it ever will, but hopefully it will get normal. And yeah,
Well, I
thank
hope
you so much. I
you.
can't thank you enough for doing this with me. It's been
Well,
absolutely
thank you. It's lovely to talk to you. It really is. And of course, I can see you as well, and you look fantastic. And you're obviously, you cope incredibly well.
yeah,
I don't see. I don't really know how all the others have coped. One I see a bit around the place who seems to cope very well, just because they live in Chelsea. But and I
yeah,
see, but. I don't know. Occasionally, because I do get patients from St Thomas's pitching up, and one came last week. I had operated on for a different problem, for
yeah,
facial reconstruction it was, and it was an interesting new operation. And microvascular, and she's written a little book about it. Anyway, she came back she came because for a consultation, because the doctors that she is seeing couldn't, didn't dare do anything because in case they mucked up what I'd done. But
yeah,
that was quite useful. I wasn't going to do the surgery myself, but I will guide her towards someone who
yeah.
can. In fact, she looks tremendous. But she's another person like you who's coped in life absolutely brilliantly.
Brilliant.
But still, she's getting older now. She's how old is she? 60 or something, or not? Yeah, she's about that, I think. And I treated her when she was 17, 18 or something. But she's had a normal life.
That's brilliant. And yeah, again, I hope you have a brilliant day. Hopefully, it's good out there in the country, and yeah, have a lovely day.